Let's talk about the hemorrhoid injection. I posted about this and you guys had a lot to say. So let's get into it and talk about how this works, how it's done, and how it should feel. So hemorrhoid injections are for injections for internal hemorrhoids. These are not done for external hemorrhoids, and I'll explain to you why. They should be painless. You might feel a little pressure. You should not experience a sharp pain with this needle. And the reason is that when we're injecting this solution, which is alcohol and olive oil, phenol and olive oil, into the hemorrhoidal apex way up here where you don't have sensation fibers, it should not hurt. If the needle goes out here in the skin outside, this hurts. So before we go ahead and inject anything, and this is part of the reason why I need such a long needle to do this, is this scope has to go into the rectum. So we lube this up, this goes into the rectum, and then I pull this slot out, and I generally have a light that allows me to see in here, okay? So when I'm looking in there, I'm gonna see your hemorrhoids poking out into my scope, and then I can go ahead and use a needle that I guide in there to do the injection. This is also why I need such a long needle. The whole needle does not go in, the tip of it does, but in order for me to get it through the scope, I need a long needle to be able to do that. The reason we can do this injection and have it be painless, I've explained before, is once you're in here and you're into the rectum, you're supposed to be injecting above the line of sensation known as the dentate line. And you might feel a little bit of like a pressure sensation, but that's really all you should feel. Now, why is banding so painful then? Because a lot of you commented that you'd had bands and that hurts even though you were told they wouldn't. I don't love banding personally. I will do it selectively for some individuals who don't respond to this, but I don't love it personally because you will feel the sensation of the band. The band is a tourniquet that kind of like goes around the hemorrhoid, and you will feel that pressure, and people feel tenesmus, which is the urgency to have a bowel movement, which can linger for several hours sometimes to even several days. If a band is placed wrong and it's placed too low, your doctor will have to take that band out because you can't put a tourniquet on skin. And this is the same reason you cannot inject or band anything external. If I inject this needle out here into an external hemorrhoid, you're gonna hurt for many days. If I put a tourniquet on your skin, you will have skin necrosis, and you cannot have that done. So we can't do any of the stuff for external hemorrhoids. We have to resort to other treatments for that. For those of you who commented that you had needles stuck down there and that it hurts, that's because they were sticking it into an external hemorrhoid, for example, to numb it up in order to remove a clot. That will hurt. If you've had Botox into the anus, we inject Botox in the skin and through the skin into the muscle. That hurts. Hemorrhoidectomies hurt like crazy, and that's why I prefer treatments like this, which are non-invasive. They could be done in the office. You don't have to take off from your day in general for these procedures. You can go about your life, and we can treat these non-invasively to avoid bigger procedures and surgery. Hopefully that helps. If you still have any questions, go ahead and comment. I will answer.